keratogenesis myself that has a scar protocol. Any thoughts on that particular laser? Do you not know the platform enough to be able to comment on that particular
Yeah,
one?
yeah, we don't. It's not one of the ones that we utilize. We probably cover that wavelength a little bit different laser, but may not have the same pulse length. The erbium laser, it's like a CO2 laser. We have a fractionated CO2 laser absorbed by water. Those are for skin tightening because you can use to ablate and remove tissue.
And wrapping up this
One
section,
thing, well, and talking about scars, and I think you may have been going to go there, but as far as treatments, like if hypertrophic scars, keloiding type scars, and when we're faced with those, we do a lot of injection, and that has changed definitely in the last 10 years. That before we would just inject steroids and steroid. That's all we had when I was in my residency and for first starting out. Kenalog into that, then you can get some atrophic scars. You can get some problems. If it was really terrible, we would use radiation therapy. So you can radiate keloids, or you can cut out a keloid, sew it together, and immediately radiate the area with an old-fashioned laser, old-fashioned radiation, get superficial treatment, and not have a keloid come back. But 5-fluorouracil, FU, to be is really the key for us now. We use that in conjunction with Kinalog, basically 3 to 1, I think is the number that we use. So more FU than Kinalog, some local anesthetic and inject that, and that's much more successful in treating the hypertrophic and keloid scars. People in medicine may say, okay, that 5-FU sounds familiar. It's an anti-metabolite. It's basically a cancer drug that we're utilizing for that, and have been for quite a while now, like the past 10 years, with pretty good success.
yeah, we use it in the podiatry space off-label, I want to say. So it's not our first choice in the form of Efudex for warts. So it's got some antiviral activity as a modulator. I'll probably be asking you like trading recipes after the podcast. Certainly don't want people cooking up stuff in their kitchen with 5-fluorouracil. That would
Yeah.
that would probably not do either of us a service.